Almost out the door.
This is the fallout from Christmas, when rules were relaxed.
Hi Mark.
Hi.
How are you doing?
Mark is just 51 and he's now in a high dependency unit. As was allowed, his family celebrated Christmas together at home. That one gathering has been devastating.
Yeah, well, our whole family tested positive through Christmas. About 9 or 10 of us, so my mum's, my wife's stepdad just actually he just passed away in his sleep at night, so we don't know where the primary source came from. And the knock-on effect of that is that my daughter's boyfriend's family, all their family's positive.
Mark knows where he contracted the virus. But others, like Tony, who is 75, have no idea.
I hardly went out the house except, passing with that. So stay in, stay safe.
He's now on CPAP 24 hours a day, given when a COVID patient fighting for every breath starts to lose that battle on their own.
So we're down a bit oxygen-wise at the minute. There's lots of patients like Tony here who need additional support. I think we can't help but be guided by what's happening further south in England, and I think all of us have a little bit of a feeling of dread.
This was the infectious diseases ward at Monklands Hospital, but to cope with COVID patients claiming more and more beds, it's been taken over as a Redstream HDU. They're seeing more and more patients coming in who are in need of this 24-hour-a-day CPAP. They're already at capacity here, and more patients are coming in today, and more again will be coming in tomorrow.
These resources are finite. We don't have an unlimited number of CPAP machines, an unlimited number of high dependency beds, an unlimited number of intensive care beds.
How close are you to the point where you have to make tough decisions on who gets what?
It's a good question. My concern is that that time is coming in the next weeks.
With this pressure, NHS Lanarkshire has just cancelled all non-urgent surgical procedures.
Sadly, much of our capacity is created by patients dying. Yes, there are patients who get better and improve, but often it is with patients dying. And we can see that this is only going to increase, the pressures are just going to increase further.
Many of those who do recover here, particularly the older patients, are being left with long-term health problems that keep them in hospital.
We aren't turning over capacity as quickly as we have been. Patients are sicker that are coming into us, are spending longer periods of time in hospital. That's got the knock-on effect that if we're not creating capacity further down the line, that capacity then affects the A&E flow and the receiving flow. So we need to create capacity all through the hospital, but it's very difficult given that our patients are sicker. The lack of free beds hits every part of the hospital. Accident and emergency is often unable to see people within the expected 4-hour target.
It has been really, especially over the last couple of weeks, it's been really under a lot of pressure. The staff are under high amounts of pressure, and also the whole hospital is struggling.
What are we talking in terms of numbers and beds?
So the bed situation at the minute, we're trying to keep patients less than 4 hours in the department, but there's a number of people, normally I would say about 50 patients a day are making over the 4 hours waiting for beds.
And how does that impact numbers?
So it means then the department's then got longer patients in the department for longer, and then the new patients are then arriving, so you're not able to get them in as easy. So you're then, for social distancing and trying to keep the capacity down and all the patients safe, it's then putting a large demand on everybody.
But the strain of all this is not just being felt on bed capacity.
It's soul destroying, it really is. I've gone home from work and cried so many times, and I've thought, is nursing really what I want to do? And then I come in and we're a great team, it's like an extended family, so we all get each other through the shifts.
How are the nurses here coping?
It's quite an emotional question, so I can see just walking around the hospital that the staff look tired. They tell me they're tired. Some of them tell me that they're at their end point and they don't know where they're going to get the energy to get through this next peak. And I think we'll be mopping up, the emotional impact of this for quite some time, even when COVID decides to dissipate and give us a bit of a break.
I'll have to be fully honest, come into work every day and see the stress, fear and weariness on the staff's faces. We always feel that the end of the shift will always come and that will always give us a relief and a break, but when you don't know what the next day is going to be and it's most likely going to be another extremely busy day, it certainly becomes a very difficult thing to bring yourself into work every day, but staff here are incredible and we will keep working to the best of our ability.
The building itself here is also problematic. Narrow corridors were not designed with social distancing and a global pandemic in mind.
Monklands Hospital is over 40 years old. We've got a limited number of single rooms. That makes infection control and isolation of patients much more difficult. The actual size of the other rooms is a lot smaller than modern hospitals. So it's really brought to a head the challenges that we face in our current building. And we really hope that the lessons we've learned from managing COVID will begin to our new plans for the Monklands replacement that we very much hope will be approved.
There is one advantage of the hospital's layout being as it is. COVID patients aren't normally allowed visitors, but at Monklands this unit is on the ground floor, which allows for small mercies.
That's my daughter, that's my son, my grandson, and that's my wife hiding in the back.
George has been in hospital for almost 6 weeks now, but he got to see his family at Christmas and now for his birthday.
I was 65. Last week. Happy birthday, George. Who would ever have thought when they built this place a window would be so important?
These moments allow for something like normality. But behind the curtain, there is little light on the horizon. Instead, in here they are preparing for these next few weeks, bringing their darkest days yet. Peter Smith, ITV News.